Good afternoon, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing just great. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing viewer-submitted questions, addressing the latest headlines and our lone U.S. COVID statistics through today, September 5th. We invite you to submit your questions below or via any of the social media linked in the description. Starting with the COVID numbers. Average COVID deaths per day in the last reported week were down to 27, while in 2024, we saw 141 daily COVID deaths in the same week. Your reactions to those numbers, Dr. Murphy?
Yeah, creeping up just a teeny bit, but they're much, much better than last year. So this is the effect of all the people who've had COVID, all the people who've had multiple vaccines. The whole population is building up an immunity, which is keeping this thing down to a dull roar, is basically what it is. Not likely to just go away completely, but it'll end up basically kind of like the flu. It'll be competing with the flu from here out. There's still a lot of activity in the system, and the bumps are there, but they're not as bad as last year. But hospitalization rates have been increasing from, say, 1.3 to 1.7 per 100,000 population. The percentage of deaths, low, 0.5% of all US deaths, no change from the previous week. Wastewater rates are very high in some states like Alabama, Hawaii, Louisiana, Nebraska, Nevada, South Carolina, Texas, Utah, and Washington, D.C. And it's a bump, but it's a little bump.
And we do have some more COVID coverage to go over after this, but there have been some major infectious disease news stories this week, including the state of Florida, who plan to remove all vaccine mandates in the state. Can you tell us about that decision?
This is a public health disaster, because if you don't get the herd immunity, you're going to have breakthrough of diseases that we normally don't see because people are vaccinated. If you take away those mandates, a lot of people will, and especially with all the misinformation out there and everything, they'll think, oh, the vaccines are toxic, they cause more problems, more benefit than good. That is not true. And what you're going to see is like what we're seeing now with measles. You're going to have multiple, measles is never going to go away. Remember, we had 0 cases in 2000. And now, we've had, multiple outbreaks throughout the United States. But you're going to see the same thing with whooping cough, diphtheria, all these measles, mumps, rubella, all these things are going to be coming back. We're going to be like a third world country. And that is very unfortunate because some of those people will die. The mortality rate for many of these in childhood diseases is not that high. But if everyone gets measles, 2 to 3 per 1,000 die. You look at the outbreak they had in Samoa in 2018. Samoa only has 400,000 people, or 200,000 people. And when they dropped their vaccine mandate, within a year, they had 83 deaths, and then they put the mandates back in place. The vaccines have been preventing these diseases for over 50, 60 years. It should not be a political decision. Public health authorities around the world, encouraging people to take these children and susceptible adults to take these vaccines so they don't get sick. This is not going to make America healthy again. It's going to make America sick again. And we're going to pay a price. Some people are going to pay a big price.
And our first submitted question from today is from a longtime viewer, so thank you. And they asked, how quickly could we see some of these diseases start to pop up when these mandates are dropped?
Yeah, well, it takes a little while to sort of kick in. Because you have a lot of people who've had the vaccine, so they have the immunity, but people coming up for a booster shot or their first shot, young children, if they don't take the vaccine, they're going to be at risk. So you're going to see it months and years later. It'll start slow, and then you're going to start seeing outbreaks all over the place.
Mhm. And I understand that there has been what is called a Western alliance of some states on the West Coast who are coming together to try to put together vaccine recommendations that are consistent.
Well, the CDC, the former head of the CDC, who was confirmed by the Congress, all right, quit because quit, got fired, call it what you want. After only a month in the full-time position, because she was unwilling to support the basically anti-vaccine policies coming out of DHHS, Department of Health and Human Services, and specifically under the direction of Robert Kennedy, Secretary Kennedy. You cannot trust anything coming out of the CDC right now. The new head of the CDC is a person who's raised money, Jim O'Neill. He has a master's degree in humanities. He does not have any training in epidemiology or medicine or even biology. And he's going to just be putting forth an agenda that it's a political agenda. It's not a medical agenda. So you cannot, unfortunately, believe anything coming out of the federal government now regarding health. So California, Oregon, and Washington are forming an alliance. They're going to use experts, professional societies, their state societies, to come up with their own recommendations. And this will be something that people can look at, and they can take the advice of that. They're trying to work with big companies like Aetna, that the insurance company that said it plans to continue covering shots for its fully insured plans. This is for COVID, but it'll probably involve everything. If you for flu, roughly half of the 2,000 children recently hospitalized for flu, they didn't have any underlying medical conditions. So in other words, it should be all children that gets these shots, or all adults should get these shots. If you just select some here and there, based on the fact that they had underlying disease or didn't have underlying disease, you're going to miss half of them. I mean, it's really just that. So anyhow, so kind of combining the whole issue here, but the former guidelines and the guidelines of this new Western Alliance are the traditional public health approach that will protect more of the population than just letting people do what they want.
Mm-hmm. And getting specifically into one of the points you made there was big news this week also from the FDA approving the COVID vaccines, but again, on these different planes than we're used to. If you could give us that information as well.
Yeah, I mean, we start this show up every day, every week, talking about, number of deaths per day. So, you just do the math, even if it didn't change. That's, 10,000 people a year dying from that. Last year with COVID, there were a minimum of 17,000 deaths, which is kind of like what we see with the flu as well. Now, what they've done with COVID is they've limited the recommendation to very specific groups. It used to be everybody 6 months and older could take it. So they did a couple things. So over 65 and over, you can take it. There's no questions asked. Under 65, you have to have at least one underlying medical condition. And healthy children varies by manufacturer. They took away the EUA, that's emergency use authorization for the Pfizer vaccine in kids, but Moderna is okay. I'm not sure the youngest age for the Moderna one. But anyway, it even depends on which vaccine you're using. This whole thing is ridiculous. It's really designed to discourage people from taking the vaccine. The vaccines, if you just go buy the vaccine, say a doctor could write a prescription, say, here, just go buy this, and we'll give it to you. You know, it's hundreds of dollars. Like $225 typically. The other one that they don't recommend is pregnant women. It's been shown over and over again and thousands of pregnant women that if they take the vaccine, they do better with the pregnancy. They have fewer miscarriages, fewer problems during pregnancy. It's been shown in very powerful studies that have been done. And when I say powerful, it means the statistical power. It's been really shown without a doubt. So, you know, we're basically setting things up so that the public health will be worse if you follow the current US guidelines.
Mhm. And we had another submitted question today asking what what efficacy we could be looking for in these new vaccines. Have we gotten any of that data out yet?
So it's like the flu. The flu is always, influenza is always mutating and changing. Every year it's different. And the same is with COVID. They're basically doing the same kind of thing. And so you have to change the vaccine. We don't have a universal flu or COVID vaccine. So the new one is geared toward the circulating virus right now. And so that should be about 45% more effective than the older vaccine that we took before September 1st of this year. So these vaccines are available now, so you can get the new flu, you can get the new Moderna vaccine, and you'll be more protected than with the old one. The old one will still give you some protection, but you know, I want something that's 45% better.
Mhm. And on that note, we have talked over and over about studies about co-administration of the COVID and flu vaccine, which apparently there is no data for, even though we've talked about it many times on this show, that some people may be recommending to get those vaccines separately and create another barrier to entry there. So there is data out there we've seen time and time again that they actually may work better when administered together.
Yeah, that was some very interesting data from a couple of years ago, where if you took the vaccines on the exact same day, you had a better response to the COVID vaccine. The flu was the same. If you took them a week apart, it's good, but it's not as good as if you took them together. And that's just in the laboratory. We don't have there's no, because the clinical endpoints like death and hospitalization, it's really hard to track those. You'd have to do a study with like 10,000 people. People are just not going to do it. But the antibody levels are higher, and that's always associated with improved efficacy. So it's kind of it's a marker of the disease. So that's basically what's happening. And now they're not going to approve giving it the same time. It's just anytime you put it inconvenient, oh, you got to pay. Oh, you have to come back for a second shot. You know, and they're trying to build a vaccine that has even the RSV vaccine in it, which is another thing we're going to talk about in a minute.
Now, you talked about the month-long CDC director being ousted, fired, quitting, whatever it is under the sun. But along with her exit, several other key CDC members also left the agency. Can you tell us about them and what effect will this have overall?
These are some of the top people in the CDC. Deborah Houry, the agency's deputy director, the number 2 person. Daniel Jernigan, head of the agency's National Center for Emerging and Zoonotic Diseases, okay, from animals. Dr. Dimitri Daskalakis, head of the National Center for Immunization and Respiratory Diseases. Dr. Jennifer Layden, who's actually from Chicago. She had a big position in the City of Chicago Board of Health and the state. Director of Public Health Data, Surveillance, and Technology. All of them have left on their own. it's been quoted, the CDC is being decapitated. The director fired in a month after being confirmed by the Senate. And then you have the four of the top people in this agency. You know, it's just, it is just horrible. And then, you know, with the incident that happened 2 weeks ago with the shooter that shot up, you know, one of the floors he was shooting on is where the CDC employees have the nursery with their children. Kids are on the floor hiding, bullets all over the place. You know, this poor organization is just being decimated by the current leadership at DHHS, and you know, because they control CDC. So it's just very unfortunate, and so now we can't trust them. So we have to go someplace else. Illinois, we're lucky. We have a really good department of public health in the city and the state and the county too. Actually, they work together, very sound, smart people. It's good. If you follow your state guidance, you'll be fine. Or this Western Alliance, the new ones, or the American Academy of Pediatrics, or the AMA. All these, the Infectious Disease Society of America. These are where the experts are, and we can listen to them. And we're going to just have to forget about the feds until they clean that mess up.
Exactly. So more to come on that federal situation and all of those agencies, but getting more into the diseases themselves. We had some great research on RSV, the RSV vaccine specifically, and how often people may need a booster for it. Can you break it down?
Yeah, that's a good question, because RSV is the third biggest problem with the respiratory viruses. It causes about 150,000 hospitalizations per year, 8,000 to 10,000 deaths each year. It's a bad disease. The vaccine is approved to be given once so far, and you know, they didn't know how long that was going to last. And they found that over time, the antibody levels do go down. So there's going to have to be a booster at some particular point. However, it looks like, based on this study, this is from the JAMA, Journal of the American Medical Association, a really good journal published out of here in Chicago. They looked like the protection lasted for approximately 2 seasons. It went down 69% in the first year, 48% in the second year. But 48% is about what we get with the flu. Okay, about half, you know, and you know, that's kind of as good as it gets. But you know, the third year is going to tell the story whether or not you're going to have to get a booster. Most likely you're going to have to get one.
Mhm. And that's important to note because this vaccine is relatively new. So we're just getting this real world data for the first time.
Yeah. Yeah, the impact was so powerful, they didn't want to wait and study this for 5 years and get it out in the market and give it to the people at risk.
Mhm. Now, the biggest outbreak that we have been talking about for the past few months is the measles outbreak here in the United States. It has calmed down in West Texas, which is great, but cases continue to pop up all over the country. Can you fill us in?
So far, there's 1,431 cases. 178 or 13% have required hospitalization, and 3 unvaccinated individuals died early on in this epidemic, including 2 school-aged children and 1 adult male. There have been 35 separate outbreaks in the United States. Most of them are confirmed. This is the worst year for measles in the United States in 30 years. And the childhood vaccination rates against the virus are declining. And more patients are claiming exemptions from school requirements, and states like Florida and other ones will follow, are going to eliminate any kind of, you won't even have to have a exemption. Just, you don't want to take it, you don't want to take it. So, and the problem is people travel. So, you know, those places where the kids are at risk, from getting it, and they're going to spread it to other states as well because people travel so much. cases are not going away. The overall central epidemic of measles right now has slowed down, but it's still there. And it may just continue at this level.
And something else that we were talking about a lot and has calmed down a little bit, but still pops up is the avian flu. More cases among the poultry here and abroad. Can you fill us in?
Yeah, avian flu was found in a South Dakota turkey farm. And that was the first commercial poultry center reporting outbreaks since July. And that facility has 55,000 birds, so they all have to be culled. Overall, 175 million birds have been culled. They've had to be eliminated. And 1,000 dairy herds have become infected and had to be quarantined. So in the UK, there have been sporadic outbreaks, a couple outbreaks there as well. So it's a worldwide problem, and we'll see what happens. Still, no real confirmed case of human-to-human transmission. So that's the good news. But for the birds, it's been devastating. We'll see what happens.
Sticking with the eggs, but moving to a different illness, this time, and our final story today is about a salmonella outbreak here in the US. Can you tell us who is affected?
Yeah, salmonellosis has sickened nearly 100 people in 18 states. California had the most, with 70. It was related to exposure to certain eggs. And those eggs were primarily, the big suspect are large brown cage-free eggs distributed by County Eggs. They think is the source of the outbreak, and they put a call to get those eggs off the market, and if you have them, to dispose of them. Salmonella is a nasty infection that treatable with antibiotics, but I mean, you have to be diagnosed, and some people get really sick. You can be hospitalized. You can die from it, but it's something that we have to worry about. It's a classic bacterial food poisoning. So these eggs have been distributed in California, Nevada, under 3 brand names: Nagatoshi Produce, Misuho, and Nijiya markets. So those are the ones that they're recalling right now.
So keep an eye out for those if you're in California or Nevada. But on that note, thank you so much, Dr. Murphy, for your time and your expertise breaking down all of the stories and answering our viewer submitted questions. Much appreciated.
Have a great weekend.
Thank you. And thank you all for joining us for this week's installment of the Ask Dr. Murphy series. We hope to see you again next week. And as always, if you have any questions or comments, please leave them down below in the comments or any of our social media linked in the description. We'll see you next week.